passed overwhelmingly by a vote of 29-2 in the Missouri Senate. But even after months of hard work, a bipartisan vote out of the House Health Care Committee, 8-1 I believe, and a unanimous vote out of Rules Committee in the House, that bill never came up for a vote in the House floor. Quite frankly, that was just wrong. Missourians deserved to see a yes or no vote on this important issue last year. This year, quite simply, we're going to change that. I look forward to working with legislative leaders from both sides of the aisle and the families and advocates in this room to ensure that autism is once again a key issue when the legislature reconvenes in January. But quite frankly, when it comes to autism coverage, and one of the main reasons we're here today is that simply passing a bill, any bill, won't do. This is not about getting a bill that says autism on the top that doesn't do anything. We actually are going to succeed at making a difference here. You know, just like we've done in Missourians who suffer from prostate cancer, or breast cancer, or countless other areas. We are going to make a difference. So I want to outline, after spending the last 5 or 6 months traveling the states, meeting with families, meeting with leaders in this area, I want to outline today, as we start our efforts on this, 4 key principles that will determine my support for any legislation dealing with autism coverage. 4 principles that I believe are necessary for any autism bill to merit my support and subsequent approval. I developed these principles in consultation with doctors, legislators, insurance, parents, and other Missourians. And I believe they will lead our state in the right direction in terms of dealing with these autism spectrum disorders. First, health insurance carriers that issue our renewed health benefit plans must provide coverage for the diagnosis and the treatment of autism spectrum disorders. It doesn't do any good just to be diagnosed if the dollars don't follow for treatment. Current law allows now coverage of autism diagnosis. It doesn't cover the treatment. It is critical that in this next session, the bill have the provision that requires, once that diagnosis is completed, that ABA, other types of treatment that will make a difference in lifestyles are part of that medical coverage. 2. My second principle is that a new bill must require that insurance policies in Missouri must expressly include coverage for the medically necessary applied behavioral analysis, or ABA. I think we need to put it in law. It's working. It has made a difference. You'll hear from families today. It is working. It needs to be part of our law. Providing this type of treatment is vital to make the differences that change the lives in our state. Now, third, we also must make sure that we have enough dollars in the bill to make sure that that coverage is affordable. We think the Senate passed a measure last year. The House committees were talking about it. But we think that we should have up to $55,000 a year. As that, many other states, now 14 other states, have mandates. We'll work with folks, but having a specific dollar amount that folks appreciate, understand, and know will do the job is a very, very important piece. Third, any bill must protect Missouri families from an arbitrary cap on the number of visits a patient can receive annually with service provider for ABA or for any other autism-related service. It doesn't do us any good to have a certain dollar in there and a certain others if we don't allow the treatment to be carried out. And in some situations and in individual situations, that treatment is different. We are all different as human beings. We all have different requirements. And putting a mandated list of the amount of those visits, especially in the early stages, would be counterproductive and wouldn't solve the problem. And fourth and finally, we must ensure that Missourians with autism can get and keep insurance coverage. That's why, to get my support, any bill must not refuse to renew, terminate, or otherwise restrict coverage for individuals with autism or for dependents solely because of an autism spectrum disorder. It doesn't do us any good to have this requirement if they can then disenfranchise these folks. So, the 4 points: coverage of autism diagnosis and treatment, coverage of behavioral therapy, specifically ABA, up to a reasonable annual maximum, protection for families from arbitrary caps on the number of annual visits, and protection for Missourians from discontinuation of coverage solely because of autism diagnosis. This is a starting point for our conversation about autism coverage in the months to come. I encourage the legislature and the interim committee on autism to take these principles as the foundation for a comprehensive bill and to send me a piece of legislation that will make a real difference. When it comes to treating autism, medical experts and families in this room can tell you what works. The evidence is clear. Early diagnosis and access to behavioral therapy and other services change lives. Together, we will make a difference that affects thousands and thousands of Missourians for years to come.